It is obvious today who will pay for the insistence of our Republican colleagues that all that our country needs is more tax cuts for those at the top. And this bill in particular makes clear that those who will pay for that ideological program are seniors who rely on a hot meal from Meals on Wheels, abused children, children with disabilities whose parents are trying to help them overcome those disabilities, victims of child abuse, seniors and individuals with disabilities who want to live independently. Those are the people who will suffer as a result of this bill being adopted. And they are the same groups that Republicans in Texas have turned to pay for their approach to budgeting. In addition to cutting our public schools, we learned only within the past week that Easter seals, for example, in Central Texas being cut by over a fourth, significant cuts for Any Baby Can in Austin, Travis County Integral Care, and the same thing is true of programs in San Antonio and across Central and South Texas. As for the process reforms of which my colleague refers, and the idea that there are duplicative programs in this social service area, I think there is merit to process reform. I believe that some of our block grant programs are blockheaded, particularly the new block grant programs that Republicans want to use with Medicaid. Actually, some have suggested that Medicare be included also, and they've suggested that food stamps be block granted. I think when you give all of these funds to a blockheaded governor, sometimes you get bad results. But today, they also give us an indication that one of their goals in characterizing everything from Pell Grants to school lunches as welfare is to cut and reduce it. And by their action today, they demonstrate what could likely happen with other block grant programs in the future that in this case, they simply eliminate it with this proposal. It is also somewhat like their approach to the Affordable Health Care Act. They say they are for repeal and replace, but they're a little bigger on the repeal part than the replace part. They've never gotten around to offering any legislation on the replacement. If this were a bill to consolidate and improve the efficiency of the process of the delivery of services to seniors, to children, to the abused, to those who want to live in independent arrangements, I would be the first to embrace it. I think we can improve that delivery of services. But to simply go in and repeal this program at a time that is so critical to individuals across the country, and when groups like Easter Seals and Any Baby Can, who try to serve this population at the local level, are seeing significant cuts, it is not the inefficiency that goes first. It is the individual with disabilities who contacted us yesterday who relies on funds from this service, who is disabled and in a wheelchair and relies on these services to get urological supplies. It is the individual family that has a child with autism who is trying to keep that child at home. It is the senior the one warm meal they get a day is through Meals on Wheels. Those are the individuals that will pay for the cut and the elimination of this program. And I think it is the wrong way to fund more tax cuts for those at the top. I would like to see comprehensive improvements in this area, but not at the cost of those who are most vulnerable in our society. Repealing this block grant program, which was signed into law by Ronald Reagan and which has enjoyed bipartisan support through the years, is a giant step backward. It is not being replaced with anything. It is simply denying services to those who can least afford to lose those services. And so many of the services that come out of this program are focused on independent living, on not having to confine and warehouse individuals with disabilities, children with disabilities, and seniors who are better off staying with their families if those families can get some supports. It is a terrible price to pay for this ideological commitment to more tax cuts for those at the top. I urge the committee to reject it and preserve the social services block grant until a better and more efficient way of delivering services can be established on a bipartisan basis.